Good morning, children. Today we are going to discuss about two more digestive disorders. What are the two more digestive disorders? Last class we discussed about protein energy malnutrition diseases, kwashiorkor, marasmus. Next, digestive disorders, indigestion, constipation, vomiting, jaundice, liver cirrhosis, gallstones, appendicitis, and diarrhea we discussed. Today, two diseases are there, dangerous diseases, that is hiatus hernia. Hiatus hernia is also called diaphragmatic hernia. Hiatus hernia is also called diaphragmatic hernia. Actually, what is this problem? That one you should have to listen very carefully. It is a structural abnormality, structural disturbances in which superior part of the stomach protrudes slightly above the diaphragm. So, stomach part will be above the diaphragm, it will be protrude above the diaphragm. You know diaphragm where it is, stomach where it is, you know that. So, like this, when the stomach protruded above the diaphragm, then problem will become. So, the exact cause of this hiatus hernia is not known. The exact cause of hiatus hernia is not known till today. Some people will say injury or damage, one of the reason. Weakened muscle tissues, that is another reason. So these all are around the stomach. Okay. So weaken muscle tissues by applying too much pressure repeatedly on the muscles. Too much pressure repeatedly on the stomach muscles, this problem will become. So injury, one of the reason, or the damage when weaken muscles. Damage may weaken muscles, tissues, or applying too much pressure repeatedly on the muscle around the stomach while coughing, okay, vomiting, straining, remember during bowel movement, and lifting what you call heavy objects. So these are the main reasons. So injury or damage, weaken muscle tissues, or applying too much pressure repeatedly on the muscle around the stomach, coughing, vomiting, and straining during bowel movements, lifting heavy objects. That's some reasons. Heartburn is a common in all cases. Heartburning is a common. Why? Very important point. The stomach materials. What is it? The stomach contents travel back to. Esophagus or even into oral cavity. So, and that causes pain in the center of the chest, eroding off, because of eroding nature of acidity, the pain will pick up. Eroding means, you know, the layers will be go off because of acidity. So, these all points you should have to remember. Very, very important concept, that is hiatus hernia. So, what are the main problems in some people? What I said here, injury or damage. Okay, injury or damage may weaken muscle tissues by applying too much pressure repeatedly. Okay, too much pressure repeatedly on the muscles around the stomach. Okay, coughing, vomiting, straining during bowel movement, and lifting heavy objects. What will happen? Heartburn will be takes place. So these are the main reasons for the what is called hiatus hernia. Come to next dangerous problem, ulcers. Those are called peptic ulcers. Very dangerous. Peptic ulcers. What are the peptic ulcers? We are going to discuss now. The eroded area. What is peptic ulcers? eroded area. Eroded means what? The layers will be go off because of HCl. The layers of the intestine and stomach, lining of intestine, especially mucosa in the stomach and duodenum, the lining will be go off mucosa. So duodenal ulcers occurs in the people. Very important. The duodenal ulcers. I am telling about duodenal ulcers occurs in the people age group of 25 to 40 years. Duodenal ulcers. Duodenum. Gastric ulcer is more common in person above the 50. Duodenum 25 to 45. Gastric stomach 50 years. Ulcer is mostly due to infections caused by the bacterium. The ulcer is mostly due to infections. Which infections? They are Helicobacter pylori. Bacteria name is Helicobacter pylori. You know, Nobel Prize in 2005. Robin Warren and Barry Marshall got Nobel Prize for inventing of Helicobacter pylori peptic ulcers. So, Helicobacter pylori. What is the reason? This is one of the reasons. Helicobacter pylori causes what you call peptic ulcers. Next, anti-inflammatory drugs. Usage of aspirin, one of the drug you know very well, or certain anti-inflammatory drugs like drugs. Next, smoking, alcohol, caffeine, and stress. These all are also causes the which one? The ulcers. Very dangerous ulcers. They are called peptic ulcers. Mainly two types of ulcers, right? Gastric ulcers, duodenal ulcers. Duodenal ulcers about 25 to 45 years age group. In between 25 to 45. Gastric ulcers above 50 years people, especially above 50 people will get a gastric ulcers. And also bacterial infections also main causes for ulcers. Helicobacter pylori. It's a bacteria which causes ulcers. And the usage of aspirin and anti-inflammatory drugs, smoking, alcohol, caffeine, and too much psychological stress. Very dangerous. Psychological stress also. Psychological stress also causes ulcers in the body. Peptic ulcers in the body. Are you understanding or not? So that is about what you call peptic ulcers. So hiatus hernia. It's a structural abnormality in which superior part of the stomach protrudes slightly above the diaphragm. Stomach part protruded above the diaphragm. So very dangerous problems. These two are peptic ulcer and hiatus hernia. So maybe exact cause of hyperemia not known. Injuries or damage, maybe weakened muscle tissues, applying too much pressure repeatedly on the muscles around the stomach, then coughing, vomiting, straining during bowel movements also, lifting heavy objects at the time, heartburn will be takes place. So what will happen? Stomach content is there or not? The stomach contents travel back into the esophagus. So esophagus to oral cavity, the pain in center chest. So eroding nature of acidity will be takes place. Then peptic ulcer, eroded area of the tissue lining, especially mucosa in the stomach and intestine. So duodenal ulcers between 25 to 45 years people. Gastric ulcers above 50 years people will get. The common reason for the peptic ulcers is one common infectious bacteria called Helicobacter pylori causes peptic ulcers, and also usage of aspirin, anti-inflammatory drugs, and alcohol, smoking, caffeine, psychological stress are also some of the reasons for this ulcers. Next, obesity. This is the very dangerous problem. Nowadays, everyone is suffering with this problem. Everyone is suffering with this problem that is called obesity. Why obesity? Too much eating, excess eating of the food. So sometimes genetic disorders also, it is genetic disorder also, maybe the genes, hereditary diseases also, disorder also, but maximum oil food, junk food. Okay, very unwanted food we are taking. So because of that, this obesity we are facing. So now obesity is caused due to the storage of excess of body fat in adipose tissue. Storage of excess of body fat in adipose tissue causes obesity. Storage of excess of body fat in adipose tissue causes obesity. Body fat. What I said? Body fat. In the adipose tissue, in the adipocytes, connecting tissues are there or not? Adipose tissues, which insulates the temperature, which stops the lossage of body temperature. But here, excess. Generally, adipose tissue good for us to stop the loss of heat. But here in this case, what is happening in the obesity case? Every food, carbohydrates converting into fat and storing in adipose tissue. Protein converting into storing in the adipose tissue. Fat and lipids, lipids will be stored in the adipose tissue. So, what are the problems will come because of high storage? So, it may be induce hypertension, high BP. When the obesity is there, the blood pressure normally 120 by 80, right? So, here in this case, what will happen? More than 120 by 80. So, blood will be, the cholesterol will be, or what you call triglycerides or fatty materials will be, blocks the movement of blood in the blood vessels, that is leads to what you call hypertension. When the coronary artery is blocked with cholesterol or fat, that leads to heart attack also. Here I am telling hypertension. Hypertension means what? More than 120 by 80 BP. 120 is the systolic pressure, 80 is the diastolic pressure. So more than 120 by 80 is there in the sense that is called hypertension. Even atherosclerosis, heart disease. So they will blocks all the blood vessels, and then heart problems will become very, very, very dangerous. So because of obesity. So obesity is the mother of all diseases. Obesity is the mother of all diseases. Next, diabetes. What is diabetes? So insulin secretion is not sufficient. Our pancreas islets of Langerhans secretes the insulin, but that insulin is not sufficient. When our body overweight is there, that insulin unable to convert the glucose to glycogen. Too much glucose, too much glucose, too much fat, too much. Then there is no conversion of glucose to glycogen. That is leads to what? Because of less amount of insulin or too much body fat, then glucose will accumulate in the body. So not sufficient insulin leads to diabetes problem. But this is not only, this obesity is not only because of overeating. Remember this point also. The obesity is not only because of the overeating, but it is hereditary. It's a genetic disorder. Due to genes also, the obesity will become. And what is the genes? Father, mother, parents, very well, like that, parents to offspring. Due to excess intake of food, what kind of problems will become? So when you take the excess intake of food, endocrine and metabolic disorders. Endocrine means hormone imbalances. Metabolic means there is no conversion of simple to complex, complex to simple. See, hormone imbalance means very dangerous. Endocrine problems. Thus not sufficient amount of hormones will not sufficient for too much heavy body. Then that is leads to disturbance. Even metabolic like sugar. Diabetes is what? Metabolic disorder. So obesity, excess food is there in the body. So all problems will be endocrine problems, metabolic diseases, thyroid problems, overweight, kidney problems, heart problems. All problems will be will occur to that patient. So obesity is a very dangerous problem. So we should not neglect the obesity. As early as possible, we should have to reduce our weight. Next, BMI, body mass index. Body mass index. So this is a very important. So body mass index, if you check regularly, that is good. Why? What is body mass index? You know very well. So the degree of obesity is assessed by body mass index. A normal body mass index range for adult is in the year 19 to 25 age group. 19 to 25. So in adults. And above 25 means that is the obese. So what is body mass index? How can you? Body weight kgs by square of body height in meters. Weight by height. Weight by height. So you know very well spirometer, basal metabolic rate. When the respiration rate is okay, identify metabolic rate, you want to identify spirometers they will use. But here also same like that, body mass index. How much weight is there? Either you are obese or not. How can you guess? In the sense, there will be one principle is there. What is that principle? Body weight in the kgs by square of body height in the meters. Weight by height. Weight by height. Kgs by meters. So that is called body mass index. So adult body mass should be below 25 or 25 maximum. So if above 25 is there, the body mass index, those people will be considered as a obese. Finish. They will be in the obesity. They have so many problems will be slowly will attack. So many problems like what I said. Hypertension, atherosclerosis, diabetes, metabolic disorders, endocrine system failure. These all system problems will become when the patient have which one? This heavy body mass index means more than 25 BMI is there. That's it. They are obesity patients. For example, here they given 50 kgs of the weight. One person weight is 50 kg weight. And height is 160 centimeters height. So what is the BMI? Basal metabolic index, body mass index is 19.5. We called 19.5. So how can you say 50 by 1.6 square is equal to how much? 50 by 1.6 square 19.5. So 19.5 is body mass index. What do you call? Body mass index. Like this, by the help of body mass index rule principle, we can estimate the person is obese or healthy or perfect weight is maintaining or not. We will be checked. Lifestyle also, because of lifestyle changes also, because of that lifestyle, food habits, especially food habits causing obesity. And this point already told. So the peptic ulcers is there or not? Helicobacter pylori. In the 2005, the Robin Warren and Barry Marshall did research on helicobacterial peptic ulcers. They invented the causative agent of the peptic bacteria. What you call peptic ulcers is one bacteria called, what is it? It seems Helicobacter pylori. Helicobacter pylori is causes the peptic ulcers. Like that, the great scientists who Robin Warren and Barry Marshall, very important bits. Robin Warren and Barry Marshall worked about the Helicobacter pylori. So like this, children, almost all are important and concepts are there in the related to the digestive system. So hiatus hernia, what we discussed today, hiatus hernia. So structural abnormality in which superior part of the stomach protrudes slightly above diaphragm. Peptic ulcers, eroded area, eradication or eroded area of the tissue lining, especially mucosa in the stomach and intestine. So that is peptic ulcers. Overweight, obesity, and body mass index. Okay, body weight by square of body height in meters. So Nobel Prize who got about peptic ulcers, who received ulcers, or who got Nobel Prize about the peptic ulcers also we discussed.